Welcome back to the River City Hardball Podcast. I'm your host, Andrew Gibson. Our friend Jacob Evanich from Optimized Physical Therapy and Sports Performance joins us, as he does each and every week here on the podcast. How we doing tonight, man?
I'm doing great, man. Good day of getting some training and a couple evaluations in with people. So blessed with what I do, and it's been a really good day. So excited to do this as always as well. So.
I know that you can't speak on like specific cases with different people, but like what were we training today? What were some things that we were doing today?
Yeah, well, luckily today, so of course I do have some people who are injured, overcoming, elbow injuries or shoulder injuries. But today was it's a nice day when you just have people coming in to train for the off-season programming. So today was just pretty much a couple evals to determine what we need to train specifically for those people, so I can come up with a program. And then the other couple were guys who I've already seen for a while, so it was time to actually start the new phase of their program to kind of get ready for the season, because it's coming up so quick. It's kind of crazy, but high school practice is starting in about 6 weeks or so. So it's time to really hit it for the off-season training.
Yeah, for sure. As one season ends, another begins, and it happens very quickly, for sure. Let's get to our topic tonight. We wanted to discuss rotator cuff injuries. That's always a big one, especially in baseball.
Yeah, it is. I don't know. I feel like everybody hears about the rotator cuff, and as we were talking about things to do for the podcast, I was kind of thinking in my mind, and I was really surprised that that's one that we haven't talked about yet.
Right.
A lot of people know about the rotator cuff and everything, but I feel like a lot of people don't know specifically what it really does and what to kind of look out for an injury with it, and what the rehab process kind of looks like. So I thought it'd be a good topic for tonight. And actually, this one is for people of all ages. Everybody has to deal with the rotator cuff, but especially younger people with who are throwers and overhead athletes. So you're definitely the baseball, of course, especially pitchers, but then also volleyball players, tennis players, anybody who's doing a lot of upper body movement and high velocity movement has to deal with stuff like this.
Explain the function of the rotator cuff.
Yeah, so basically it's 4 different muscles. So when you say rotator cuff, that it's just a general term saying all 4 of those muscles. And those muscles, like we talked about before, how the shoulder is kind of like the humeral head is the ball, and then what we call the glenoid fossa, which is the part of the scapula. So I'm going to keep going back to this all the time, but so you have your T, which is the glenoid fossa, and then you have the humeral head, which fits right on it. And then you have the rotator cuff muscles that kind of surround that, along with other things like ligaments and the joint capsule. And those muscles help kind of tighten the kind of compress that humeral head to the glenoid. So as we're moving and things, it keeps the shoulder real stable instead of allowing that humeral head to kind of bounce around. If that would happen, then injury risk would increase and what have you. So that's the main function of the rotator cuff. And the bicep tendon, or the bicep itself, the bicep brachii, that actually helps a little bit with the stabilization and compression of the humeral head as well.
When we hear about rotator cuff injuries, is it usually a torn rotator cuff? Is that usually the diagnosis?
Sometimes. So there are a lot of different kinds of injuries for it. Basically, generally categorizing them, there's some tears. So you can have partial tears or full thickness. We'd call it partial thickness or full thickness tears. The full thickness tears aren't as common, so that would be a complete tear through the muscle or tendon of the rotator cuff. That's not as common. It can happen over time, but in throwers, it's usually a partial thickness, so there's a little bit of a tear going on. Other times, there's just some general inflammation, like a tendonitis, happening in the rotator cuff. So those are typically the 2 things that kind of happen. Once you do have inflammation with like a tendonitis, it can progress over time because you have so much inflammation that over time it can become one of the partial tears, basically. And then if you don't still take care of it, then over time it can become a full thickness tear. With those, if you're throwing, you're having, a lot of times it'll start with kind of like the tendonitis. So there's different kind of impingements. There's like an internal impingement, which is more the back of the shoulder. Some of the bones pinching onto the rotator cuff in the back. There's like a subacromial, is a common one, which is more of the pinching kind of the more the front of the shoulder and side of the shoulder. So those are two of the areas that commonly get impinged between the bones. And once again, if you don't kind of take care of it, then over time it can become that partial tear.
It's interesting when you said impingement, that brought something back, because I remember when I was playing sports, in high school and stuff, I actually had a shoulder impingement when I was lifting weights. I had some dumbbells overhead, too far.
Yeah.
And so I think I had some shoulder impingement, and I don't know, I thought I'd tore my rotator cuff at that point, but I didn't know what was going on.
Yeah, like you saying that with going up overhead, that's when we talk about making sure your shoulder blade muscles are really strong too, because and that the shoulder blade is mobile. Because if it's not, then things do kind of pinch together because there's not a whole lot of space in that shoulder. So if if that glenoid and the shoulder blade isn't really moving up to keep everything kind of in line along with that humeral head, then we start getting a little bit more of that impingement. So that's why it's so important to keep the mobility, but also make sure all those muscles are strong enough where they're moving appropriately. Because yeah, exactly. Even something as simple as a shoulder press, if we don't have good movement, it can cause those impingements.
I think what I was doing at that time was probably too much weight overhead, and that usually happens that way. We're talking about rotator cuff injuries here on River City Hardball with Jacob Evanich from Optimized Physical Therapy and Sports Performance. So rotator cuff injuries, pretty serious. I mean, that seems like if you've got if you're a pitcher and you have a rotator cuff injury, is that a season-ending type deal?
Yeah, it's definitely serious. So you never want it to progress to the point where it is tearing, especially a full thickness tear. Then it's pretty tough to come back from if you're especially a pitcher and an overhead athlete. But luckily that isn't too common. But if one of the kind of the symptoms in general are if you would have a really hard time throwing, decreased velocity, a lot of pain, and a lot of weakness when you start testing the strength of that shoulder, that's when you're thinking there might be something kind of major. And that's kind of the clues for all injuries of the shoulder, is to see if there's kind of like decreased velocity, a really big increase in pain, and just weakness in that shoulder in general. And then if those things are kind of going on, we know we need to look a little bit further, and there might be something significant going on. But especially the rotator cuff, because it's the muscle. So if you do any of the testing and that muscle is actually completely torn, it's going to really hurt the muscle, and you're not going to have the strength. But yeah, then the partial thickness and everything, as long as we catch it early, it always starts with conservative treatment and rehabilitation, so physical therapy, to allow the inflammation to decrease, try to let everything heal up a little bit on its own, and then try to strengthen the shoulder blade and shoulder itself and rotator cuff.
I know with various injuries, we talk about the mechanism of how the injury happens. Mm-hmm. How does the mechanism usually happen for a rotator cuff? Is it pitching? Is it hitting? How does it usually happen in a general sense?
Yeah, so typically a little bit of fatigue. You're kind of overloading it. So if everything's tired, muscles not working appropriately, then over time that can kind of progress to, especially like when we're throwing and we're trying to slow down our arm, that can cause a little bit of what we call the eccentric use of the muscle, where the muscle's trying to control the movement as it's getting longer, instead of like when we do a bicep curl. That's more like the concentric movement where everything's kind of shortening with the muscle. But then as we're going down and straightening our elbow, that's called like the eccentric movement, where we're really controlling that movement. That's a lot tougher on the muscle. So same when we're throwing, as we're going through the motion, as we're starting to especially decelerate, that can put a major strain on the muscle, so the eccentric force. And we can just get inflammation over time from the overuse. And then also it can lead to, as we were kind of talking about before, and it can lead to the tendon failure or the muscle failure.
What does the rehab process look like for a rotator cuff injury?
Yeah, so if we're catching it early and you're just having a little bit of discomfort in the shoulder, then try and do anything we can to decrease the inflammation. So massage, different massage techniques, even like things like, the cupping or what have you. And then a big thing is making sure we're looking at the full mobility of the shoulder. We always want to make sure we're keeping everything as mobile as possible. So as we've talked in previous podcasts, if you have, decreased external rotation or internal rotation like that, total arc of motion, that's something we need to make sure we get back. And then if we also don't have the shoulder flexion, like coming up overhead, that's something we need to make sure we're working on, because that's always an indicator of just general shoulder health. So we always look at the mobility first, get that movement back. And then after we get the movement back, then that's when we can really hit the strengthening a little bit harder. And part of that also, as we always talk about, is the shoulder blade along with the rotator cuff, making sure that all that is pretty strong and moving well. And then as the inflammation goes down, as the pain goes down, as we're getting pretty strong, then we can keep bumping everything up to actually do some pretty, heavy lifting. So as we keep lifting heavier and heavier, the bigger muscles start kind of working as well. But the rotator cuff muscles actually have to work harder as well to make sure everything's being stabilized in that shoulder. So, and that's another thing that I didn't mention previously. When you're asking the role of the rotator cuff, we call it like a stabilizer. It's basically like a stabilizer muscle, how we were saying. It keeps everything compressed and in place. But the big muscles do the big jobs. So we call those like the primary movers. So even when we're throwing and everything, we're using the pecs, we're using the lats, deltoids. Those are the big muscles. But the rotator cuff and some of those shoulder blade muscles are some of those like stabilizing muscles. So over time, we keep bumping up how much we're lifting. And the big muscles are getting trained too, because they need to work when we're playing sports and with everything we do. So we train those, but as we keep increasing load, then the rotator cuff has to work even harder as well. So it's just a gradual progression to try to get back up to basically full lifting.
A final moment or two here with you tonight on rotator cuff injuries. What are some tips for athletes, pitchers, what have you? It could be any position in baseball.
Mm-hmm.
What are some tips to try to avoid rotator cuff injuries?
So biggest thing, in my opinion, is just really making sure, how we had talked about mobility, making sure you're maintaining that mobility throughout the season. If you are having any pain at all, it can throw off your mechanics. So make sure you get your body right before you keep trying to throw through something like that. Because if we start having the pain, mechanics get off a little bit more, and we can cause a different injury based off of changing our mechanics. And then just really making sure, you are having at least some kind of basic arm care, but even it's more preferable to actually be on a pretty steady lifting routine where you are lifting some pretty heavy weights to make sure all that is staying in really good shape. But I guess the ultimate out of anything, no matter where you are, whether you're younger or a little bit older, going to professional ball or something, just listen to your arm. That's the biggest thing. So if you're going out and you're throwing, doing your long toss or going to go do your bullpen, if it doesn't feel good that day, you don't have to throw. You don't have to keep pushing through it. Listen to your arm, and when it's ready to throw again, it'll let you know. So maybe you could do, instead of doing really aggressive long toss, your arm just isn't feeling that great, so you only go out 120 feet that day, and then pull it back in. Then the next day you start feeling a little bit better, so you can keep going back out and resume your arm care program or throwing programs. But listen to your arms. That's probably the best advice I can really give if you're a thrower.
It is fascinating how many muscles and tendons and everything that have to work in concert together to make sure that you're doing it the right way to prevent injury. That's one of the many things that make this podcast so interesting and so much fun to talk about, is there is just so much that just goes on in the body to get the throwing motion and everything right.
Oh yeah, it's crazy. And like we talked about slap tears before.
Yep.
So if that rotator cuff isn't working very well and it is really fatigued, then it can't compress everything as well. So then it starts, putting more stress on the labrum throughout the shoulder. Bones start rubbing against bones, and we can get some osseous or bony injuries. So it's crazy. Yeah. But what's even crazier is we can train our bodies to make sure they are moving pretty well, and that we can do things like throwing for years with some guys, like Max Scherzer until he's going to be 40 years old by the end of his contract. Like, it's amazing what we can do if we train our body to really perform when we go out there.
And still throwing at high velocity as well, and almost 40 years old. It's amazing to see these guys, what they do. Jacob Evanich from Optimized Physical Therapy and Sports Performance. Always appreciate a few minutes. Very good stuff tonight on Rotator cuffs. Thanks, man.
Yeah, absolutely. Thank you, Gibby.